Hi, my name is Ram Patel, and my project this year is on identifying the neurochemical signature of cerebral vasospasm in patients with subarachnoid hemorrhage. I'm intrigued by all the work done in the neurosurgical field and further research on numerous topics that I would have had a possibility to research. The study of vasospasm appealed most to my interest, and I was able to find a mentor currently doing research on this topic. A subarachnoid hemorrhage is caused by an aneurysm rupture that bleeds into the subarachnoid space of the brain. The lead can be repaired, however, a potentially lethal complication known as cerebral vasospasm can kill 50% of the 70% of people who survive a subarachnoid hemorrhage. This condition constricts the blood vessels in the brain, leading to a deficiency of blood flow and even death. There are some treatments that are currently used, such as triple H therapy, vasodilators, injected arterially, and balloon angioplasty. However, these have only had limited success. The pathophysiology of vasospasm is unknown, and it has a varied onset after a subarachnoid bleed, so treating it becomes a very difficult task. There are several speculations about the causes of vasospasm. ENOS is an enzyme that produces nitric oxide, which is an important vasodilator of blood vessels. According to a past study done at Duke in 2006, a subarachnoid hemorrhage causes impaired endothelium-dependent related responses mediated by the nitric oxide. The breakdown of blood products leads to an intense inflammatory response that parallels the time course for vasospasm, and it's thought that certain metabolites cause vasospasm to arise. This project will take place at Yale with Dr. Balsara and his research team of residents and medical students during its course to isolate certain metabolites that we think might be causing vasospasm. Metabolomic profiling will be utilized to distinguish specific metabolomes within the CSF to identify biomarkers that could be causing vasospasm. I wrote a review article over the summer that focused on the utilization of metabolomics in subarachnoid hemorrhage patients to gain a further understanding for the means and goal of this project. Then I had the chance to observe in the lab over the summer and view the methods used to study this chemical signature in the cerebrospinal fluid. But first, the fluid had to be drawn before and during vasospasm to study the changes during each stage of the disorder. LCMS and GCMS were used, and it separated the components within the cerebrospinal fluid and displayed them to us. The data handler recognizes the different components and also measures the quantity of the compounds. The measurements considered significant are changes in the metabolomes within the CSF of greater than 1.5-fold and a p-value of less than or equal to 0.01. These methods have given us the 5 amino acids to look further into and have given us the ability to try and identify any significant quantities or quantity changes that occur. This is the analysis of the data done so far for the project, and as you can see, there are two metabolites with big differences from the other, but further analysis needs to be done to be certain of the root cause. If we can distinguish which amino acid assists in the breakdown of nitric oxide and cause vasospasm, it can lead to the development of a chemical signature that can be used for the early diagnosis and development of improved therapies for vasospasm. Thank you for taking time to watch this video.